Just to tell you a little bit about myself, I won't be boring, I'll try not to be. I trained as a nurse in the late 60s and early 70s, and that was at a time when we had nurses in uniform, almoners and matrons. And I have to say, sometimes I think bring them all back. I know we have modern matrons, but I was scared stiff of my matron at Guy's Hospital, and she was an amazing woman. And I do think that sometimes we need to think that not everything in the past was bad. I became chairman of the Croydon Health Authority in 1998 until 2001, and then I became the chair of the Primary Care Trust, and I remained there till 2013. I was also a former chair of the Health and Wellbeing Board, and I suppose the job that I enjoyed most was being chair of the London Specialised Commissioning Board, and I did that for a couple of years. And I had a budget of £1.5 billion, and you'd be surprised the sorts of things that we used to have to cover with that funding, and whether it was mental health or health within prisons, or perhaps somebody in a hospital who was here on holiday and delivered 5 babies all in one go, and we had to care for the babies and indeed for mother, as was the right thing to do. I also chaired in the past, I've been 32 years on the council, and I have chaired Social Services Committee. And I suppose the last health thing that I'm on is I've been a member of the Whitgift Foundation for 22 years, a member of the board there, and I chair the Whitgift Care Committee. Of course, is the Whitgift Care Centre in the Carer Centre in George Street is one of my projects, and I'm very proud to say that Croydon Healthwatch have their offices there and work very closely with Helen Thompson, the manager. Now, a personal view I'm going to give you, and it's not a political view, is about the fact that I see, the greatest danger that I see is that we will have a workforce crisis in health and social care. And I think this is probably to do with uncertainty about Brexit. And we need to know whether, quite soon, we need to know whether EU nationals will be allowed to stay here and work in our health and care systems after Brexit. Because what is happening, and I'm told this by care homes and other establishments, and indeed local hospitals, people are being trained here. They wonder about the future, and they decide to go back to their country of origin. So we mustn't let that happen. We need to have quality people here who have been trained, so they can go on delivering our services. And we know how hard it is to recruit into the system at this time. I think, in time, whatever party is in power, that an honest conversation with the British public about how we fund health and social care. And I do see Healthwatch Croydon being incredibly involved in that, and I would have thought that was something that we have to all look towards. As already said, I'm going to disagree with Ray slightly over the figures. I'm told that our figures in Croydon are nearer 400,000 people, and I know that we have 401,627 people registered with our GP list in the London Borough of Croydon. And it is said that we will increase by 12% in the next 15 years, and it'll be somewhere in the region of 450,000 people living in this great borough of ours. I always say Croydon's the centre of the universe. On reflection, I think throughout my life when I have worked in the care industry, there are 5 things that lead to a good quality, looking self-care really. I think we all need a good start in life. We need to be in control of that life. We need to have good employment. And we need to have a healthy standard of living and a safe home and a good community. And we've already heard about refugees in some of our hostels feeling that they're not being able to register. And I'm so pleased that that was one of the projects taken up by Healthwatch. And the fact is that, again, there was some mention made of children. We have got 1 in 3 of looked after children in London, the whole of London, they reside in Croydon, and it is to do with our Home Office. And as already said, very often these children do have mental health issues to do with trauma. I've spoken to one young man recently who was 16, and he had walked right across Europe from Syria to end up in a camp outside Paris, and eventually got here. And he does have quite serious problems, from being sexually abused, almost starved at one point because people wouldn't give him any food. So it is very, very difficult. And we are all living longer, and I do worry about older people, not just because I'm getting old myself, but I recently found out that 1 in 25 older adults live in homes that have got no heating. That's appalling in the 21st century. 1 in 10 adults receive social care. That's a lot of social care. 1 in 8 25 to 64-year-olds are unpaid carers, and I know that from the work from our Whitgift Carer Centre. And 1 in 2 older people report not getting enough social contact. And that leads me on to an example I'm going to give you with regards to an elderly. I have a group of older people that I'm very fond of in my ward as a councillor. And I had a call from this lady's neighbour who said that Mrs X, I'm going to call her Mrs X, was talking to herself. She'd hear her in her garden talking to herself, and as she went down the path she talked to herself, and she was worried about her health and well-being. So I went to visit the lady in question, Mrs X, and how was she keeping? And she cried. She was talking about her loneliness and her isolation and how she didn't do clubs. And she said, it's killing me. So I do talk to the plants, I talk to myself, because I've no one else to talk to. And that made me feel really, really sad. I have connected her with a group, and there's a very nice lady who goes to collect her, so she can go to that group. But as I left her, I gave her a hug, and I was very conscious that perhaps I was the first one that hugged her in 7 years since her husband died. There were no children, so it was just her and her husband. And I have convinced her also to get a cat, which she calls Tiger. So we do have a lot of older people out there who are, isolation and loneliness is a greater killer than cancer. And the World Health Organization says that, not me. And I think we should also keep an eye on our neighbours. And all of those lovely 70 volunteers you have, you need to say that too when you go out. We need to do that, because you're going back to Mrs X, she doesn't have a mental health problem, she has a loneliness problem and a feeling of isolation and not a part of her community. I also would like to just suggest something when I was cabinet member for business and jobs, I used to talk to employers and businesses about mental health, because again, I have people who used to come into my surgery as a counsellor, and they would be frightened to tell their employers they were on antidepressant drugs. They could sort of perhaps 50 weeks of the year do incredibly well at work, but they might have two weeks when they were unwell. And I remember another person saying, I have to keep up this appearance of being happy all the time, but I don't feel happy. She had debt problems, she had all sorts of problems which caused stress, anxiety, and in the end, mental health. So I think Healthwatch Croydon have you know, a whole area there to look at, and I'm so glad that you are, and that you are working with Mind in Croydon, and the Chief Executive, Richard, here, who I understand is a member of the board. So you have him, and he will be able to help all of those people. I think it's getting through to the businesses. What's your policy? What's your procedure? How do you help those staff? And generally, that the hardest working staff who suffer from stress and anxiety. And I also think that there is tremendous support for the work done by the NHS and the social care staff, but we do know that not all expectations are being met. And your Chief Executive today has taken me through the new system of communicating with people and getting feedback about services. And I think that is fantastic, because you're getting it from the heart. You're getting it from individuals that have been affected, rather than perhaps thinking about it, or perhaps someone speaking very loudly and saying, this service is, can I use the word crap? And etc., etc. So I think we need to refocus on health inequalities and diversity. And in the areas of Croydon where we have greatest need, such as the north of the borough, and we have talked about, again, Ray talked about women very often needing to go to a woman GP, and their daughters going to a woman GP, and that's very important, and I'm so glad that that's a project that was taken on. I think we need to do more about preventative and outreach work, and that should really focus on the deprived communities. But when I say deprived communities, I also mean people like Mrs. X, who may well be financially secure and live in a house, but she still is deprived. She's deprived of social interaction and company and being part of the community. I think we also need to truly integrate. Now, I adore the chair of the not the primary care trust, that's gone, the GP commissioning group. And Agnello Fernandez is a great GP, he's a great chair, but I do really think we have to look at working closer together, but also including the voluntary organisations more, to make sure that we have an integrated care system that really, really works. So elderly people or other people who need, people with disabilities who need support to leave hospital earlier, so that's arranged quicker. I could go on, but I'm not going to. I just would like to say thank you very much indeed for all that Healthwatch Croydon does, and it continues to deliver. I think we are fortunate. We tend to moan a lot about services, but I think we are on the whole fortunate to be able to have a service that Nye Bevan decided for us all those years, 60 plus years ago, and still is free at the point of delivery. I would like to thank Croydon Healthwatch for their work over the past year and support they have given to the community. There's no price you can put on that, and I know they're going towards another bid, and I wish them all the best. They are the voice of the patients and the carers, and they enable residents, I think, to feel in control of their care and to be able to make informed choices. Thank you very much for listening to me.